Personality disorder. The best treatment options. A personality disorder is a type of mental disorder in which you have a rigid and unhealthy pattern of thinking, functioning and behaving. A person with a personality disorder has trouble perceiving and relating to situations and to people. This causes significant problems and limitations in relationships, social encounters, work and school. In some cases, you may not realize that you have a personality disorder because your way of thinking and behaving seems natural to you. And you may blame others for the challenges you face. Personality disorders usually begin in the teenage years or early adulthood. There are many types of personality disorders. Some types may become less obvious throughout middle age. Symptoms. Types of personality disorders are grouped into 3 clusters, based on similar characteristics and symptoms. Many people with one personality disorder also have signs and symptoms of at least one additional personality disorder. Cluster of personality disorders. Cluster of personality disorders are characterized by odd, eccentric thinking or behavior. They include paranoid personality disorder, schizoid personality disorder and schizotypal personality disorder. It's not necessary to exhibit all the signs and symptoms listed for a disorder to be diagnosed. Paranoid personality disorder. Pervasive distrust and suspicion of others and their motives. Unjustified belief that others are trying to harm or deceive you. Unjustified suspicion of the loyalty or trustworthiness of others. Hesitant to confide in others due to unreasonable fear that others will use the information against you. Schizoid personality disorder. Lack of interest in social or personal relationships, preferring to be alone. Limited range of emotional expression. Inability to take pleasure in most activities. Schizotypal personality disorder. Peculiar dress, thinking, beliefs, speech or behavior. Odd perceptual experiences, such as hearing a voice whisper your name. Flat emotions or inappropriate emotional responses. Causes. Personality is the combination of thoughts, emotions and behaviors that makes you unique. It's the way you view, understand and relate to the outside world, as well as how you see yourself. Personality forms during childhood, shaped through an interaction of 2 factors. Your genes. Certain personality traits may be passed on to you by your parents through inherited genes. These traits are sometimes called your temperament. Your environment. This involves the surroundings you grew up in, events that occurred, and relationships with family members and others. Personality disorders are thought to be caused by a combination of these genetic and environmental influences. Your genes may make you vulnerable to developing a personality disorder, and a life situation may trigger the actual development. Risk factors. Although the precise cause of personality disorders isn't known, certain factors seem to increase the risk of developing or triggering personality disorders, including family history of personality disorders or other mental illness. Low level of education and lower social and economic status. Verbal, physical or sexual abuse during childhood. Neglect or an unstable or chaotic family life during childhood. Being diagnosed with childhood conduct disorder. Variations in brain chemistry and structure. Personality disorders usually begin in the teen years or early adulthood. Complications. Personality disorders can significantly disrupt the lives of both the affected person and those who care about that person. Personality disorders may cause problems with relationships, work or school, and can lead to social isolation or alcohol or substance abuse. Tests and diagnosis. If your doctor suspects you have a personality disorder, exams and tests may include physical exam. The doctor may do a physical exam and ask in-depth questions about your health. In some cases, your symptoms may be linked to an underlying physical health problem. Lab tests. For example, your doctor may order blood tests, such as a complete blood count or a thyroid test, to determine if a physical health problem may be causing some of your symptoms. Your doctor may also order a screening test for alcohol and drugs. Psychological evaluation. This includes a discussion about your thoughts, feelings and behavior and may include a questionnaire to help pinpoint a diagnosis. Sometimes it can be difficult to determine the type of personality disorder, as some personality disorders share similar symptoms. But it's worth the time and effort to get an accurate diagnosis so that you get appropriate treatment. Treatments. The treatment that's best for you depends on your particular personality disorder, its severity and your life situation. Often, a team approach is appropriate to make sure all of your psychiatric, medical and social needs are met. Because personality disorders are long-standing, treatment may require months or years. Your treatment team may include your primary doctor, psychiatrist, psychotherapist, pharmacist, family members, social workers. If you have mild symptoms that are well controlled, you may need treatment from only your primary doctor, a psychiatrist or a therapist. If possible, find medical and mental health providers with experience in treating personality disorders. Lifestyle and home remedies. Along with your professional treatment plan, consider these lifestyle and self-care strategies. Be an active participant in your care. This can help your efforts to manage your personality disorder. Don't skip therapy sessions, even if you don't feel like going. Think about your goals for treatment and work toward achieving them. Take your medications as directed. Even if you're feeling well, don't skip your medications. If you stop, symptoms may come back. You could also experience withdrawal-like symptoms from stopping a medication too suddenly. Learn about your condition. Education about your condition can empower you and motivate you to stick to your treatment plan. Get active. Physical activity and exercise can help manage many symptoms, such as depression, stress and anxiety. Activity can also counteract the effects of some psychiatric medications that may cause weight gain. Consider walking, jogging, swimming, gardening or taking up another form of physical activity that you enjoy. Avoid drugs and alcohol. Alcohol and illegal drugs can worsen personality disorder symptoms or interact with medications. Get routine medical care. Don't neglect checkups or skip visits to your family doctor, especially if you aren't feeling well. You may have a new health problem that needs to be addressed, or you may be experiencing side effects of medication.